Welcome everyone, and thank you for joining our webinar today. My name is Suzanne Walker, and I'm the Senior Marketing Manager for Public Health here at Jones & Bartlett Learning. I'm here today with Chris Palmetto and his two authors, Michelle Kiley and Meredith Manzi. Chris is going to be talking today about how and why you can integrate a public health approach into your health and wellness course. So now let me introduce you to our presenter, Chris Palmetto, and his two authors, Michelle Kiley and Meredith Manzi. All three of them hail from CUNY's Graduate School of Public Health and Health Policy. As you can see from the slide, Chris Palmetto is an associate professor, Michelle Kiley is an associate dean of research, and Meredith Manzi is an assistant professor. In addition, all three of them are also authors of the new health and wellness text, Personal Health, A Population Perspective, which incorporates the public health themes we'll hear Chris speak about today. And with that, I'd like to turn over the presentation to Chris.
Thanks, Suzanne. So this is Chris Palmetto, and I'm very excited to be presenting today's webinar. Much of what I'll be sharing with you today comes from what I learned working on the J&B textbook, Personal Health, A Population Perspective, which is written by Michelle Kiley, Meredith Manzi, and myself. And we're all proud to work, as Suzanne said, at the City University of New York. We call that CUNY, City University of New York, CUNY, Graduate School of Public Health and Health Policy. So I'll be making some introductory remarks and go through some of these points, and then later my colleagues, as Suzanne said, will be joining me for the Q&A portion of the presentation. So first part of the presentation is very briefly, why? Why should we teach health in college? Why is it so important to teach health in college? And the first thing is that health is a major foundation for future success. So in public health, we learn about the importance of health and the importance of health as a contributor to so many other future life success factors. And health itself is a facilitator, can be a facilitator to college graduation. It can also be a barrier to college graduation, and we obviously want to keep our students healthy so they graduate. And college graduation is an extremely important predictor of lifelong health. So it's important that when you're involved in college education, that we ensure that our students have every opportunity to graduate, because that's one of the greatest predictors of economic success and future success in general. And so I want to add here that at CUNY, at the City University of New York, my co-author Meredith Manzi and I are affiliated faculty in the Healthy CUNY Initiative, which deals with these very issues. It looks at the City University of New York as a population, which it is, at around 300,000 students. When you add all the 25 colleges together, adds up to about 300,000 students. And the Healthy CUNY Initiative works on public health solutions to issues around mental health, sexual health, health insurance, and food insecurity, and seeks to intervene and help students overcome those barriers. And it's guided by the principle that health should never be, I think everyone will agree on this, health should never be a barrier that prevents a student from graduating, and unfortunately it too often is. So the next question is, why should public health be integrated into a general health education? And I'll bring up two analogies that help emphasize why we believe public health, and hopefully you will all agree, why public health should be a really key component to general college health education. And one is what we call the upstream parable. And I'm sure everyone knows the upstream parable and has thought about it to some extent or another. We talk about upstream solutions in public health and outside public health. And the gist of the public health, the upstream parable in health is that, people are pulling others out of a river who are drowning. And they keep coming down the river, flowing down the river, drowning, and we are pulling them out and pulling them out. And finally, someone asks, what's going on upstream? What are they doing upstream to cause them from drowning? So are they jumping? Are they being coerced? Are some populations more likely to fall in upstream than others? And what's happening downstream? Hospitals, surgeons, pharmaceutical drugs, street drugs, incarceration. These are all sort of downstream issues. But what can we do upstream? And that's the public health inquiry. So upstream issues include vaccines, tobacco control, sexual health education, seatbelt laws, water fluoridation, school meal policy, school physical education policy, and on and on. These are not individual decisions, they're collective decisions, and they can have as much of an effect on our health as the things we quote unquote decide or choose to do. And so this is how public health frames its work. Another analogy that can help us understand why it's so important to teach public health in a general health context is the analogy of the fish tank, the fish aquarium. So, you can provide checkups for your fish. You can examine their fins, their gills, their scales. You can quote unquote educate the fish about the importance of nutrition and get swimming all around the tank to get good exercise, right? But what really makes a difference in the health of the fish? The policy decisions, right? The policy decisions that are made about the size of the tank, the food that's available, the quality of the water, and the other inhabitants of the tank, and so on. And you can see from this picture that these fish are treated pretty well, actually. They look like they've got a good public health system in place, probably better than a lot of humans get, actually. Now, for the college student, just like the fish tank, our social, well, before I get that, you might say that the college student has more free will than fish in a tank, right? That's an obvious thing. But I would say as the parent of two college students, I can tell you they're really not that much different. I'm not sure they have as much free will. For the college student, their social environments, like the culture around sexual assault, for example, or their policy environments, so alcohol and Greek life policy, for example, and their built environments, sidewalks, bike trails, walking trails. All these policy choices have a major effect on their personal health and their communities, and in fact, our planet. So bringing in the public health perspective helps remind college students about the we, or the us, in health, in addition to the I and the me. And they're not mutually exclusive, but as we're making the case in this presentation, it's very, very important. In fact, it's critical. In fact, it's obligatory to describe and communicate all these factors that actually lead to the health decisions. And a quick note about general health at colleges. There is a pedagogical movement out there to sort of rethink general health, general education in general, and how it connects individual topics such as personal health with the wider world. This is something that we're seeing all over the place in colleges and universities. Harvard College's Bach Center for Teaching and Learning is one example of this, but there are many, many more. So this is actually part of a growing trend, I would argue. All right, so give me some examples, you might say. All right, I'll give you some of the examples that we use in the book, and at the end of this talk, I'd love to hear, and we'd all like to hear your examples in addition to your questions and comments. I'd love to hear if you have some examples that we can incorporate public health into our general health education that haven't been mentioned. So I'll start by talking about food and nutrition, so how we frame it in the textbook. Give you some examples of individual food and nutrition general health education points, and then transition to how we would talk about the public health components, how we can incorporate public health into food and nutrition. And then I'll move on to some other topics, and I won't actually talk about the individual components of the other topics. I'll only do that for food and nutrition because this is really more about talking about how to bring in the public health perspective. So I'll start by just walking you through how we do it in nutrition individually, then go into the public health, and then move on to other domains and just present the public health approaches in those domains. So in the case of food and nutrition, any personal health textbook, any college general health textbook that deals with nutrition would talk about how to read a nutrition label, for example. The literacy issues of all these complex words. What do they mean? You as an individual need to know how to understand these concepts if you're going to be healthy and make healthy decisions. So obviously talking about understanding how to read nutrition labels is an important component of individual general health education. Another example is, for example, the importance of eating fiber, how to find fiber, where to find fiber, how much to eat, how to build it into your own personal diet. What are macronutrients? What are micronutrients? What do they mean? What do they do for us? What are some good ones, right? What are some overhyped ones, maybe? Vitamins, protein powders is a popular product that college students particularly consume, and other supplements. What are, the good, the bad, the wasted money? What's the information that individuals can take to make better decisions in this area? And all these diets that are out there. We hear so much. Everyone's on different diets, and an individual can sure use some information about the pros and cons of various diets. So this is the kind of stuff that a general health education would teach. What about public health? Well, look at the environment that leads to these individual decisions. And here's a picture that gives you that illustration. This is the context in which a lot of these decisions are made. So don't you think students should know about how this context is created? What are the regulatory issues? What are the business practices? Why is marketing more heavily concentrated in areas where there are higher rates of childhood obesity and diabetes? Don't you think students making individual choices should know that, whether they're in communities that don't have that heavy concentration of marketing or in communities that do have that heavy concentration of marketing? Don't you think they should have more context and information about how these corporate practices affect our individual decisions? Another area is government subsidies, say for corn, and how that makes high fructose corn syrup cheaper. Shouldn't people making individual choices know that corn subsidies lead to cheaper corn, which is what is fed to the cattle and what is sweetened into those buns and what is, of course, pumped into those beverages, the sugar-sweetened beverages? Shouldn't we know why they're so cheap and how that leads to our individual decisions? And again, this role of marketing, how marketing is done, where marketing is going, the higher rates of chronic disease around the world, is that connected? And many people have made the case empirically that there is a connection between increased food marketing and rising rates of chronic disease. And when you talk about all these issues, there needs to be some talk about solutions to these problems. So for example, we want to reach a place where the healthier choice is easier to make in terms of nutrition. There are many, many ways to get to that. And one of them is corporate procurement. So cities purchase a lot of food for events. Corporations procure food and spend a lot of money on food. Everywhere we work, there's decisions that are being made, and to intervene on those decisions and change those decisions and make those decisions healthier can lead to healthier individual choices. So these are some examples of how individual information is given can be given generally given at the college health level, and how public health information is given at the college health level in the area of nutrition. And so Again, I'm not going to talk about the specific issues around exercise, the specific guidelines. In our book, of course, we do talk about that, recommendations, different types of exercise for you as an individual. But in terms of public health, we also talk about things like the infrastructure, biking and walking trails, sidewalks. So the picture you see here looks like a very nice infrastructure. And money, how was the money assembled, cobbled together to make this infrastructure? The policy decisions that led to building this bridge and putting a pedestrian component into the bridge. All these have enormous effects on our public health, and that needs to be brought into our health education classes. Same thing with physical education in schools. When schools are overly focused on test taking to meet these standards, and in order to do that, they start cutting back on their physical education program, that has an effect on our health. And that kind of information should be discussed. And likewise, we are creating in the 21st century all these incredible product innovations. Many of them will have an enormous effect on our health, and this is a fun way for students to learn about this issue of the upstream determinants of our health. The upstream determinants are not just government and policy choices, although they are very important, but they also involve corporate innovation and product development. The next area we'll talk is infectious disease. So again, in our book, we teach students about what infectious disease is, the types of infectious diseases they may be susceptible to, how they work, the difference between a virus and a bacterial infection, etc., and to give them that literacy. But at the same time, we talk about the idea of vaccination policy. So there's individual vaccines. Students should know the purpose of vaccines and vaccines work, and then that leads to a conversation of how our policies affect how infectious diseases spread or don't spread in our population. Our world is increasingly interconnected, and that has an enormous effect on infectious disease. So how we address immigration, how we address migration, and how those factors are influencing our world need to be brought into the conversation of infectious disease. And likewise, the political, economic policies, same thing. So that brings us into global health. And global health is no longer something out there, which I think arguably it never was completely out there, but in the 20th century, it was more something we could talk about as abstract from our own world today. But now in the 21st century, global and political economics and our increasingly interconnected world is an important factor to discuss in health in general. We include an entire chapter about global health in our textbook, and it relates to every aspect of health. I apologize, I'm speaking from 125th Street here in New York City in Harlem, and that's a big thoroughfare for Harlem Hospital, so we get the occasional siren, so I hope you can hear me over that. So chronic disease. Now, the world is seeing an increase in chronic disease. The United States is seeing an increase in chronic disease, and students should know what chronic disease is, how it's defined, the different areas of chronic disease. They should also know the policies that can cause the increase in chronic disease. And some of that was discussed earlier. I discussed that a little bit about in terms of the food marketing, these large consolidation of food companies and how their international distributions and marketing systems are affecting chronic disease. In addition, our own nutrition policy as a nation and even environmental policy can relate to chronic disease. And Solutions, back to the solutions. What are the solutions to our chronic disease problems, increasing rates of chronic disease? And those solutions lie in government. They lie in national governments, international relationships between governments, but also corporations, of course, and their responsibility, and NGOs, in the wide range of NGOs, all have a role in chronic disease. Environmental and planetary health. So this is an area that is very much public health focused, and has sort of more, when you start talking about this, it's much more about population, upstream factors, and some of the other chapters. And in our book, we talk about GMOs, genetically modified organisms, and the pros and cons, and how GMOs are used to increase food supply, but on the other hand, GMOs are a concern among some, and so some of these issues are not completely resolved in the book, and provide great opportunities for your students to engage in debates. I've had debates about GMOs in my classes in the past, and they've been really, really fun, and I've learned a lot by just watching the students collect the research, present their cases, argue, disagree vehemently, and it ends up being a great venue for education. Again, learning about what plastics can do to your own health, but also how can you not talk about what plastics are doing to the globe. And of course, global warming is an important public health issue, and it's also an issue of equity, health equity, and social justice. So in schools of public health, and especially our school here at the City University of New York, we have a great emphasis on discussing the factors that relate to health inequalities and solutions that can lead to greater health equality, health equity, and looking at the social determinants of health and racial and ethnic disparities, how they exist, why they exist. And global warming is an area where, unfortunately, all these issues are looking like they're going to be being exacerbated. So global warming provides you with a great opportunity to talk about these issues: international health equity, social determinants of health, and social justice. So those are some examples of domains that we can talk about public health and bring the public health into the health conversation. But another way we do it, this is the final sort of concept I'll share, and that is to talk about individual stories and storytelling, and talk about individuals. It's a way to make that connection. So talking about individual stories connects the individual with the context, and encouraging students to tell their own stories is a great way to do this. So they can talk about their own health and allow them to talk about it. Then, as an instructor, you can sort of ask them and ask the class to make that connection between their own stories and the wider world, the public health world. What are the public health contexts? What are the public health decisions? What are the policy decisions that affect the story that you just told? And finally, celebrities are a good way to do this. Students, young people love to talk about celebrities. They love to think about celebrities. And we use celebrities throughout our textbook as a way to get their attention and talk about the issue that the celebrity that we're talking about in the context of the celebrity. In this case, we talk about suicide. Robin Williams talked about cancer. Bob Marley, we talk about a diet, and Penelope Cruz has a particular diet. So in the case of suicide, in our book, we talk about Robin Williams' specific, he was in the news about as someone who was affected by suicide. That allows us to bring in the public health perspective, and talk about how, in recent years, suicide has been the second leading cause of death among persons 15 to 24 years of age, and persons 24 to 34 years old, and the fourth leading cause among persons 35 to 44 years old. About 78% of the deaths were male and 22% were female. So it allows you that entree. Talking about celebrities, talking about individuals allows you that entree to get their attention. We are, as human beings, we're wired for storytelling. That's how we have been communicating for thousands of years. Many of you in communications already know this. But that individual story can and should be connected to the wider upstream determinants of these health. So in conclusion, incorporating this wider world into Gen Health helps students understand how and why to make the healthy choice the easy choice. Isn't that what we want to do? We want them to see how to make their own healthy choices, but don't we want them to also see how society can help us, how our decisions, the decisions I have just been talking about, whether they're corporate decisions, societal decisions, policy decisions, government decisions, make it easier for people to make healthier choices. And as I also mentioned, talking about this upstream, talking about the context, talking about public health allows us to discuss why health inequalities exist and how we can actually address them. So one of the examples that I use in the chapter on physical education is the case of redlining, the policy of banks, real estate organizations that outlined parts of cities where African Americans would not be allowed to get loans. Now, this happened in the 20th century, but it's still having major implications on the livability and the opportunities for healthy living and healthy exercise today. So again, isn't it important that we understand why communities look a certain way, the factors that led to that? And redlining is an example of that. Incorporating the wider world into general health helps students understand just simply the value of public health. So we're public health faculty, and for us, we focus on public health, and we have a bias that public health has enormous effect on our health, but it does. And so we talk about classic public health interventions that allows you to talk about that if you're interested in public health, and connect them with individuals. So vaccines, again, as I mentioned, tobacco control and seatbelt laws. So when students are armed with this kind of knowledge, they're not only more informed about their own path to health, but they're more equipped to take on leadership roles in their own community, to advocate for policies to reduce inequalities, and maybe even spark an interest in a career in a health-related field. And that's one of the things that we do as health educators. So before I turn it over to Suzanne, which I will in a second, this is our textbook, and it covers the issues I've been discussing, and so many more. Some additional examples we cover in the book are things like debates about including the potato in the WIC program, and how that kind of learning about that story can make you help you understand about public assistance programs and how policies lead to the choices that those that are for the food that is provided in those programs. Health insurance and health policy. So teaching students how to navigate insurance, how to understand insurance is one thing, but policy decisions went into those choices as well. And finally, sexual health, for example. We discuss human sexuality in the text, but also the political and ideological influences that affect how our own personal sexual and reproductive choices are shaped. And the list goes on and on and on. And these are just a few examples. So, and now, before I pass it over to Suzanne, I just want to say, and I might be biased, but I personally think that this textbook should be standard issue for every single college student in the country. But again, I'm biased. Suzanne?
Thanks, Chris. That was great. As Chris referenced, he is one of the 3 authors on this text, Personal Health: A Population Perspective, which just published in October last year. As he explained in the presentation, the text incorporates a broader public health perspective, really, that goes beyond individual health considerations to consider a much broader view of health, like the social determinants of health, global health, systems thinking, health advocacy. And you'll see at the bottom of the slide, there's a URL where you can go to our website and learn more about the book. But in addition to the book, please be aware that the text comes with our Navigate 2 online learning materials, which includes a comprehensive and interactive ebook, student practice activities and assessments, learning analytics, reporting tools, and more. And finally, the authors have put together an extremely helpful instructor's resource kit, which includes instructor's manual, PowerPoint slides, test banks, a midterm, and a final. Okay, well, I would like to thank you, everyone, for joining us today and for the thoughtful questions and comments. And I'd also like to extend a very special thank you to Chris Palmetto, Michelle Kiley, and Meredith Manzi for sharing their valuable insights and on how they integrate a public health perspective into their courses. And with that, I'd like to conclude today's webinar. Thank you again for joining today.